Hello, it's Dr. Shelley, and I want to give you some help because whether you're taking the next generation NCLEX exam or the old exam, or you're in nursing school, or you're a nurse on my unit at the wonderful Cleveland Clinic, you absolutely need to know how to prioritize. Too many nurses graduate and they think in terms of task. I got to get this done. I got to get that done. The patient needs an IV, antibiotic. I got to make sure I change that dressing. And they're missing the point. The point is to save the life and to prioritize your patients in such a way that the sickest patients are always seen first, not the patient that you got to do a lot of stuff with. Okay, so here we go. I got this and it's in order. I swear, this is thebomb.com. It's in order of how major these patients are. And I'm sorry, this is the way I roll, this is the way I teach, but expect a little bit of dancing. So if you want to see me up here acting a fool, go ahead and hit subscribe. Now, prioritization. Next generation NCLEX exam is all about clinical judgment. Part of clinical judgment is prioritizing. In fact, out of the 6 different variables that you got to know that this next generation test is looking at, prioritizing hypothesis is one of them. So here we go. The first one is behavior changes. I know that you learned to prioritize with ABC. Well, forget about it. It's all about behavior changes. And you will revisit the ABC, airway, breathing, circulation thing. You'll revisit that over here on number 3. But actually, people fail the test when they take ABCs to the NCLEX exam and try to base their prioritization on that. They actually need to look at behavior changes. I will give you some examples of behavior changes. I need you to write these down. Apprehension, anxiety, a feeling of doom, restlessness, irritability, altered mental status, confusion. Remember, with confusion, you need new onset confusion, right? Because like it could just be Alzheimer's. That's not a priority. But a new onset confusion, a change in behavior is huge. Don't forget, a patient just doesn't feel right and they can't get comfortable. Restlessness is really big. They're fidgety, they can't relax, they're kind of spazzy, or even agitation. And I know we think of agitation like in terms of psych patients, but this is not a psych patient and they're agitated. That should make you very nervous. I want to include in behavior changes because I think it's a big deal. And I don't know that you were taught this in school, and I'm almost sure I wasn't. Just put this with it. Because sweating is never really taught as a major reason to prioritize a patient. But I just got to tell you, if you walk in a room and a patient is sweating bullets, like there's bubbles of sweat all over this patient's forehead, their pits are wet. Well, remember why we sweat. We sweat because of anxiety. We sweat because of the body's response to serious impending doom. So sweating is a major priority for the patient. I would put that up there with behavior changes, okay? All right, now, again, we're going in order. The next one of the prioritization quickie, I guess I would call this, is status changes. And we talked about this before on my videos about case studies, but status changes mean all of a sudden new onset, previously fine and now, change in mental status. It's a change. Any change is worthy of your attention, and worthy of your attention right now because something has just happened to the patient. Let's continue, shall we? Here you go for all you ABC players. Respiratory distress. But I put song after it because here's my problem with respiratory distress. The ABCs does not mean respiratory distress. Just because someone's short of breath does not mean they're in respiratory distress. It could very likely mean that they're a COPD or a CHF patient. And so you can't go by just that. So we have created for you, for your dining pleasure, a respiratory distress song. Now you will have to pay attention instead of being over there laughing hysterically at my old behind trying to dance. But here we go. Here's the respiratory distress song. than 90, PaO2 less than 60, grunting, flaring, retracting, tachy, shortness of breath and dyspnea. Restlessness equals respiratory distress. I know, you're throwing up in your mouth. I get it. But here, let me show you what I did. This is what I did. I did pulse ox less than 90. That's huge. On your test, in your real world, at your job, if you see a patient with a pulse ox less than 90, they need your attention yesterday. Maybe your doctor did a blood gas. Perhaps the PaO2 is less than 60. Again, huge emergency. It was in the song. I don't know if you paid attention. Now, let's look at these two because they're confusing for some people. Pulse ox less than 90. That is not normal to be 91. It's just that less than 90 is crazy. Normal pulse ox is actually 95 to 100. Normal PaO2 is 80. So you're less than 60. Respiratory distress, hypoxia, hypoxemia, bad, horrible. Maybe they say something on your test about oxygen saturation. That's this one. Okay? Now, pulse ox less than 90, PaO2 less than 60. Oh, I figured it out. Here we go. Grunting, flaring, retracting, GFR. This is huge when it comes to the pediatric patient. Grunting, flaring, retracting, huge for anybody, but especially the pediatric patient, especially the baby. The baby is going to do all three, grunting, flaring, and retracting. Now, the next part of your respiratory distress, tachy. Tachy what? Tachycardia and tachypnea. Now, some of you are on some BS, and so you say things like tachypnea, Miss Shelley, tachypnea, the patient had tachypnea. No, fool, tachypnea, tachycardia and tachypnea, tachy, okay, you good? Good, because this one is a big one. When it comes to tachycardia, I'm talking about a pulse greater than 110. It's huge. You're not going to forget it. You can't. Tachypnea helps you on your ABCs, right? Because you're airway breathing. Well, tachypnea is breathing pretty fast. Are you feeling me on this? So you get a little love with your little airway breathing. Now, pulse ox less than 90, PaO2 less than 60, grunting, flaring, retracting, tachy. Last couple ones are left. Shortness of breath, dyspnea. So shortness of breath and dyspnea. Now, it just sounded good in the song, but technically these are the same thing. So this is more hookup for you on your airway and your breathing. The last one, pay attention if you were here the whole video. If you were here the whole video, this would be called last, but definitely not least. Here we go, watch this. Restlessness equals respiratory distress. Isn't that word part of this issue? Now you have evidence-based medicine to prove to you that this particular airway issue is a high priority. The most important parts of that song, this word, this issue, that issue, and this issue. Look what I left out as the most critical parts. I did not include tachycardia, tachypnea, shortness of breath, or dyspnea. I said pulse ox, PaO2, grunting, flaring, retracting, restlessness. Any one of those means see the patient first. Prioritize that patient. All right, so far we have behavior changes, status changes, respiratory distress song, and I would like to add a word to the respiratory distress song, but it doesn't fit the song, so we're just going to add it on the board. That would be cyanosis. That's your patient, baby or adult, turning blue. Cray, cray. Let's continue, shall we? Worsening back pain if the patient's over 40. That literally means an abdominal aortic aneurysm. They're going to die within about an hour. Immunosuppressed with flu-like symptoms or perhaps a UTI. The immunosuppressed patient doesn't have enough white blood count or immune system. What am I trying to say? The patient that is immunosuppressed does not have the immunity to fight infection, does not have the white blood count or T cells or B cells to fight infection. So when they get an infection, it kills them, takes them and puts them into sepsis, which is usually the reason why they died. So watch your cancer, watch your autoimmune diseases. Here's some autoimmune diseases that you should really watch. Multiple sclerosis, myasthenia gravis, Guillain-Barré, Lou Gehrig's, trigeminal, Bell's palsy, Parkinson's, Huntington's, lupus. Just a few autoimmune diseases. A few of those are actually immunosuppressed. Number 6, if your test talks about an immediate post-op patient, that's usually within the first 2 hours after surgery, that's a priority. If you just got a new admission, that's a priority. If you just got a transfer, be careful with this. It's always a priority, but they make it sound like it's not. For example, they'll say something along the lines of your patient has arrived after being transferred from the ICU to step down. And if you think about that, it sounds like, wow, they were in ICU, now they're in step down, they must be getting better. Wrong answer. There's still a transfer. And I'll tell you this as a nurse of 40 years. My immediate post-ops have coded. My new admits had been a piece of crap and should have been gone down to, the ICU from jump. My transfers from ICU have gone right back down to ICU because it should never came up in the first place, but ICU always needs a bed, so you know how that goes. That's every hospital everywhere. You are the nurse to decide whether they're appropriate to stay on your floor or not. Let's keep it moving. Then under number 7, remember, 7 tips on how to prioritize in the next generation NCLEX, which is focused on clinical judgment. Your number 7 has a list. VFib, VTAC. Watch my EKG videos. Tachycardia greater than 110. We talked about it already. Blood pressure less than 90/50. You know what that means, don't you? Shock. Then there's a blood sugar less than 70. Oh, let me help you with this. A low blood sugar will kill you much faster than a high blood sugar. So if it's less than 70, you better know that that is a huge priority. In fact, blood sugars less than 70 are such a huge priority that if I don't have anything pressing from this list, in the list of patients that I just took report on at work, I will always see my diabetics first. So I hope this helps. 7 tips on how to prioritize on the next generation NCLEX exam. Bye, y'all.